isn't pain keeping you from doing the things you love? Our guest this morning is an avid horseback rider, but pain kept her out of the saddle until she found relief that she needed at NeoGenix. We welcome Leta Stewart to the show. Leta, how are you doing?
I am doing so super.
All right, Leta, you had some major back pain, right?
I did.
Let's talk about this. How bad did it get?
It got so bad that I couldn't walk more than 10 feet without leaning against a fence or a wall or sitting down, and I couldn't stand for more than 2 minutes without sitting down.
Well, for most people, surgery becomes an option, but surgery was not an option for you. Why?
My father himself was a surgeon, and he had to have multiple back surgeries during his lifetime, which cut his career short. He eventually became an invalid because of all of it, and I knew that I did not want to have back surgery.
So you're watching Charlotte today, and you hear about NeoGenix, okay?
I do.
And you hear about how we brag about stem cell therapy. So what really intrigued you?
The fact that it was non-surgical, be done in the office, had good results. You're not cutting on me. Yes, we went in to get the stem cells, and then also when we did the platelet-enriched plasma, but it was virtually painless and very quick.
What about the physical therapy?
Physical therapy has been fabulous. He noticed things right away and started working on trying to get my core stronger, and I'm just really getting stronger every time.
What would you like to say to the staff at NeoGenix?
Oh, keep recommending IV rehab, and keep doing what you are doing, because I know that you can help so many people, and it's not a difficult thing to go through. It's just wonderful.
Tell me about the routine now you can do with your horses that you couldn't do before.
I can go out to the pasture and get him. I can bring him back in without stopping. I was having to stop and lean against a fence about every 10 feet. Or maybe even sit on the ground for a second. And then when I get into the barn, I'd stop and sit on overturned muck buckets until I'd get to my cross tie area. And then I'd have to keep sitting down while I was grooming him and tacking him up. And I can do that so much more easily now without having to stop and rest. And it's just fabulous.
Let's bring Dr. James Altizer in now. You treat a leader with stem cell therapy. You say that it is safe, it's effective, and it's also proven science. Let's start with the word safe. Where do the stem cells come from? Because this is really important.
The things that make our treatment so safe, number one is, at NeoGenix, you're going to be seen, evaluated, diagnosed, and treated by a physician. And most other so-called stem cell clinics in the area can't say that. We use stem cells that come from the patient themselves, so there's no risk of bloodborne infections. Plus, the one off-the-shelf product we use, Horton's Jelly, is the safest product on the market in that category. We also use imaging to diagnose patients, x-rays or MRIs, and all our injections are done with real-time imaging, either ultrasound or fluoroscopy. So we know exactly where the stem cells need to go.
So how effective have these treatments been on the thousands of patients that you guys have worked on?
Well, I've been doing this for 5 years. We have over a 94% success rate with all of our treatments. Stem cells have been used worldwide in literally millions of patients.
And when it comes to the clinical science, what clinical science evidence do you have that stem cell therapy works?
There are literally thousands of articles that come out every year, and patients can access the same articles that I read on the internet to prove that in over a decade of use worldwide in millions of patients, stem cell therapy is safe and is proving to be very effective for a wide variety of musculoskeletal conditions, including arthritis.
So why is this a better option, stem cell therapy, than surgery?
Well, surgery, even though it's standard of care now for a lot of conditions, it has risks. Even a routine surgery carries risks of infection, blood clots, and artificial joints don't last forever. They can break, they can wear out, they can get infected. So if you've been told that you might need surgery someday for a joint problem, it's certainly worth your time to investigate stem cell therapy, because in a lot of cases we can delay or maybe even prevent joint replacement surgery in people with arthritis.
What has your family and friends said? I understand your friends said that you're 2 inches taller.
The first time they saw me afterwards, everybody's like, oh my gosh, look how great you're standing. And you look 2 inches taller. And they're like amazed.
Well, we're glad that you're feeling 2 inches taller. So call NeoGenix for a free consultation to see if you are a good candidate for stem cell therapy. The consultation can be virtual or in office. The number is 704-727-6551. You can also visit neogenixstemcells.com. You are 2 inches taller, girl.
Thank you, Eugene. It was great to get to talk to you.
I'm glad you're feeling better.
Thank you.